knee replacements have been being done since really the mid-70s, and there were a number of advancements that took place early on. Those were mostly mechanical kinds of advancements. So they were materials and designs and surgical techniques and things like that. Through the 80s, it started to become fairly mainstream. In the 70s, it was pretty experimental. In the 90s, they really kind of took off and became fairly popular for older people who weren't super active, to help them get walking again, typically. Through the 2000s, of course, we've now got people my age and a little bit older who, as a group, tend to want to be much more active. We're into many more things, and because of sports and other activities, people have worn out a lot of joints. Mm-hmm. So, but the technology has continued to advance and has gotten to the point now where we can do it as an outpatient.
The advancements, I would imagine, you mentioned the things that you've tried to do as a surgeon and as a doctor, a healthcare provider, and helping your patients. But I would imagine also the companies out there that are doing so much R&D, research and development, on the actual devices and the tools that you use during surgery, right?
Yes, that's right.
Have changed and have really helped you.
That's true, they have. And in fact, they've advanced to a level now that the instruments and the devices aren't really the issue anymore. We've largely conquered the material issues. Knee replacements just don't wear out. The instruments are really, really good. I have a virtual reality workstation in my operating room that allow me to take data points from a patient's actual knee and basically put together a new surface or a new knee that's exactly custom fitted for them. The size, the shape, the alignment, everything done right there using computers in the operating room. The outpatient knee replacement, which really is a resurfacing procedure, is essentially the same as other knee replacements that I do for patients not as an outpatient. Mm-hmm. What's changed really that allows it to be done as an outpatient is the technique of getting it in. So using minimally invasive, muscle sparing, no tourniquet, avoiding the vessels so that there's very little bleeding associated. Long-acting medications, specific kinds of blocks and anesthesia. Right. This whole combination of things in medications and technique is what allows that same surgery to be done in a way that allows people to go home and walk on it right away. But the expectation is still that it will last every bit as long as any other knee replacement that we do.